Hi, this is Dr. Nirmala, gynecologist and urogynecologist from KIMS Hospital, Secunderabad. Today, let us know about a condition called Bladder Pain Syndrome. This comes under the spectrum of a more commonly known condition called chronic pelvic pain. So, why are we discussing about this topic today? The reason is this condition is not very uncommon, and the people who are suffering from this condition, they actually have a very inferior quality of life over time. So over years, this condition has not been scientifically addressed and treated till the recent past. So this is the time we know about this condition. Typically, there is pain or a discomfort or an unpleasant sensation in the lower abdominal region and or the urogenital region. So these symptoms could be associated with the more common symptoms of bladder, like urgency of urination or a frequency of urination and or waking up very frequently in the night, what we describe as nocturia. These conditions, as we understand, are very common or overlapping with the common condition, that is urinary tract infection. So only in the absence of urinary tract infection that we come to this diagnosis. That is why we call it a diagnosis of exclusion. So although the symptoms are common, we have to identify this problem as a specific entity. Whenever there is an intense desire, like an urgency to pass urine, there is usually an associated fear of pain or increasing discomfort as the person continues to hold on. That is how we distinguish this condition from other common conditions like overactive bladder, which have been treated so well all these years. So who are usually affected with this condition? Although bladder pain syndrome can affect people from all ages, this is more common in women, particularly after the age of 30 years. The reason specifically cannot be known. The symptoms could vary from mild pain or discomfort to an unpleasant sensation to a severe pain arising from the pelvis when the person is unable to move and carry on with their routine activities. There may be times when the symptoms are completely under control, and this could be for days or weeks or even months, but this condition is not like completely cured. We have to be ready to face sudden flare-ups in between, and there are usually some triggers, and whenever the flare-ups happen, they are usually worse. So we have to identify what is causing this condition in on and off. So coming to the common triggers, as we commonly think that green tea is healthy, yes, it is healthy, but excessive of anything is not good. So excessive tea, green tea, excessive intake of caffeine, even soda, soft drinks, and definitely alcohol. Coming to the treatment of these conditions, there are very few and simple tests that we need. Most of the diagnosis is based on a clinical examination and simple tests like urine examination, and occasionally we proceed for more investigations like a cystoscopy when we need to look inside the bladder with a telescope, and that is an office procedure too. So there is not much of hospitalization needed for the treatments. Basically, we intend to rule out urinary tract infections, tuberculosis, some cancer-like and precancerous and cancer conditions before we embark on the proper treatment of this condition. So what does the treatment involve? It is basically the education of every person who is going through this trouble about the disease itself. Understanding the disease and our own body, how it is handling the situation and going through the disease, it makes a great difference in the patient's ability to overcome the disease. There is counseling involved about the natural course and the behavior of the disease, and also what we can expect as a reasonable outcome of the treatment. The behavioral therapy usually consists of a controlled intake where we give a customized guidance to each person about how to control the intake of water and also the timing of voiding. This goes a large way in handling the symptoms, and the person herself or himself is in good control of the problem. As we had discussed about the dietary triggers, so there are certain diet modifications that we suggest, and that is usually enough for the treatment. The mainstay of the treatment is, of course, management of pain, because that is the most bothering symptom. So the management of pain is also not a very invasive procedure, usually with tablets and some physiotherapy mechanisms. That is how the pain is alleviated, and it helps it helps to a great extent to the discomfort that the person is undergoing. As specialists in this field, it's our responsibility also to avoid the further flare-ups. In this treatment protocol, it's usually a combined effort from the urogynecologists and the urologists, the pain physicians and the pelvic floor physiotherapists, and that is how we give a comprehensive treatment and the problem is kept under control. There are also some quick relief measures when we do an intra-bladder installation. That means we make a mixture of certain medicines which give quick relief and we put them inside the bladder and let the drug stay for say 20 to 30 minutes. And this is usually done once a week for say 4 to 6 weeks. And this gives a very good relief, and there have been few scientific studies comparing different modalities of treatment, and all the modalities work more or less the same, and that depends on what treatment is suiting a particular person undergoing this condition and the choice of treatment. So my message to everyone is, let us not continue suffering. Let us identify the problem, seek help. There are very good and simple treatments available. So let us avail the technology for a better well-being of all of us. Thank you.